I am thrilled to be here today with Tarun Kapoor, Chief Digital Transformation Officer at Virtua Health in New Jersey. Tarun, what a pleasure it is to have you on the show and welcome.
Bobby, thank you so much. Appreciate the opportunity to chat with you a little bit more and to chat with your listeners.
Fantastic. So, tell us a little bit about your background, how you got into this role, and also a little bit about Virtua and the populations that you serve, and a little bit about key priorities for the organization itself for the year.
Yeah, sure. Thank you very much. So starting with the first part of the question, my journey, wherever you go, there you are, I think sums it up. I don't think this was ever truly planned. I'm a physician by training, internal medicine hospitalist. I was actually going to be a gastroenterologist. I had a fellowship lined up, and then I came to profound realization that I just didn't really like abdominal pain. So I actually gave up the fellowship before I started and was gainfully unemployed. I ended up joining a startup, and it was at the time when hospital medicine was just emerging. So I was a hospitalist. We grew a hospitalist company business, and was able to exit that successfully. From there, again, another transition point, and it's a recurring theme in I think in my journey. And from there, I got an opportunity to get connected with Virtua. Been very fortunate at Virtua. Been a number of different roles, ranging from informatics to being part of the medical group to population health. And then in 2019, I was asked to take on a stretch assignment for digital. We had done only 5 ambulatory video visits in 2019. I set the goal for 500. Lo and behold, March 2020 comes along. And as the saying goes, better lucky than good. So we finished just a little bit short of 200,000. So yes, did exceed our goal that year. And that's hence the role we created to hardwire some of those accelerations from digital transformation that was being produced. How do we hardwire that into our organization such that we just don't go back to the original way of doing things? Hence, we created a digital transformation office, and I'm so fortunate to be able to head that team up. With regard to your question about Virtua is the integrated delivery network in the southern part of New Jersey. Think of right along that Philadelphia latitude. And in terms of a market, it's actually New Jersey's pretty dense from a population density perspective. And one of the things that's really interesting about our market is there is a tremendous diversity in socioeconomics. One of the facts that we call out is we have some of the more affluent neighborhoods that have, one of them actually has 2 Apple stores within 10 minutes driving distance of each other. 7 miles away is Camden, New Jersey, one of the most disadvantaged communities. And actually, just a startling fact, the life expectancy amongst those 7 miles is 16 years. And I think that tells you it's an important point for us to be thinking about, including in our digital transformation. We got to make sure that what has continued to probably create inequities does not continue to accelerate forward in the process of digital transformation. So that's a little bit about how we got here.
Well, it's such an interesting comment you make, and so it indeed seems to be true that zip code is really a predictor of mortality, life expectations, health equity, and all of the other stuff. And the data point that you shared is just a stark reminder of the fact of life as far as healthcare goes. So, talk to us a little bit about your key priorities for the organization and how the digital transformation function fits into those priorities.
Yeah. So I don't think some of the key priorities I'll list out for you are that much different than many of the other integrated delivery networks. There has been these remarkable swings since 2020. Tough year, lots of shutdown of business operations, so essentially suppressed demand. 2021, for a number of health systems, ourselves included, saw a dramatic rebound of that demand. Likely, it was that suppressed demand from 2020 coming into 2021. And then, now comes the Omicron surge for us, which actually hit us from a volume perspective harder than the first surges did. And then again, oof, what a tough first quarter for that, from an economics and running the business. Now, again, rebounding back, but I think one of those things that is really an important thing for us is understanding the volatility of market. I mean, that is not classically something you would think about in healthcare. Healthcare, that was always the story about healthcare, right? Quote, people are always going to be sick. They're always going to need healthcare. It's a recession-proof business. It's anything but, and it's being impacted more than ever before. And then I think but going one step further, understanding that, the demand for healthcare is actually way more elastic than I think we quite realized or expected, right? We don't understand why was it we literally did not see strokes, nearly at the same volume before. I mean, you have a stroke, you would think people do come forward with these symptoms, right? It's alarming. So I think it has prompted a way deeper or some deeper questions about what is truly happening with our consumers, whether you use the term patients or consumers, that whole separate conversation. So that the consumer focus, understanding what is their need, is really hopefully driving for us what is where we're trying to take apart.
Well, I'd love to, actually dive into that a little bit more. So you talk about consumer focus, and you just described the fact that within your area, the areas that you serve, there are stark differences in the profile of the consumers. There's one town with 2 Apple stores within 10 minutes of each other, and the other town with highly disadvantaged population. So when you look at your priorities as Chief Digital Transformation Officer, how are you directing your investment? How are you factoring in these significant differences in your populations, which I'm assuming translates into differences in expectations from a digital enablement standpoint, right?
Yeah, 100%. And I think so within the priorities within our digital transformation office, I will quote a formula that we stole from someone who we know stole from somebody else. So I'm not exactly sure what the true origin it is. So, but that formula is NT plus OO equals COO, right? And that just, the listeners on this podcast get nothing out of my words. Memorize that formula because it continues to keep our team.
Say that again.
NT plus OO equals COO. So what does that mean? New technology plus old organization equals costly old organization.
Okay.
All right. So for me, we have a budget for digital transformation. If it was as easy as buying a technology, we would have all have transformed at this point. But if you simply just buy a technology and you wire it into the existing organization, you are open for basically, you're going to be just an expensive version of what you were previously. And if we were previously good at what we're doing, then why are we doing the digital transformation?
Yeah.
So I think we try to spend a lot of our time from our priorities understanding the operations and where is there a mismatch between what the consumer is asking, truly asking on one end, and how we provide it today. And then say, what are the ways we can transform? And so hence, my title is Digital Transformation Officer. I would say the T in that title is the capital letter. What is the transformation that has to occur? And then where is digital come into it? But where is also the operational change that has to come in? If you do not match those two, and sometimes it's going to be a real problem. And sometimes the digital stuff is ready and the operations is not. It's not ready for the transformation. Sometimes the operations is ready and the digital is not. It's not ready for transformation, right? So that match, I think, is crucial. We spent a lot of time saying, is it ready? And that's where I think we've been successful so far.
So can you maybe give us 1 or 2 examples of how you've actually implemented this thinking in practice at Virtua? Where do you start? Do you start with a journey map? Do you start with consumer research? Where do you start before you eventually land at the technology?
Right. So and I don't think I have one very good answer. I think, and one thing, other factoid is rarely is there a right answer, but there's usually a few wrong ones to start with. If you can try to avoid the ones that are pretty clear, like, yeah, that's probably wrong. That at least helps you cull the field. And then you have to pick something and go. So in some cases, yes, you do your consumer research, you get focus groups, you get data back, but don't get paralyzed, right? Do not get paralyzed by saying, okay, well, I need more data, I need more data. Make an educated guess, get a prototype out there, and then get feedback. And then probably 5 iterations into it, you actually start to realize, that's what the person's after. And I think, this concept of agile design in software that has been around for 20 years. Agile design in an integrated delivery network, it doesn't happen. And so I think if we, as for those of us that are in healthcare, can specifically start thinking in these more rapid iterations, which is very uncomfortable for us, right? Because I think, as a physician by training, one part of the Hippocratic Oath and all of our statements is statement primum non nocere. First of all, do no harm.
Right.
That you would never hear that in a software development company. They're completely fine with it being, that was a bad idea. So I think we have to find a balancing act of, maybe it was a bad idea. It was safe, but that just didn't make the mark. And I think one example would be online scheduling. Mm-hmm. Right? So we've had online scheduling, quote, on. Technology has been there. But what we realized as we started digging deeper is, but there was a complete mismatch between what the consumer was seeing and then what the doctors and our medical group had on their schedule. So the analogy I would give you is, if you called the office, or let's use an airline. If you called the airline, American Airlines, or whatever you want to call it, the ticket agent or the call agent could see all the seats on the plane. If you physically were at the ticket counter, that agent could see all the tickets on the plane. But if you went to the website, they could only see rows 3 and 4. Okay, so how is that online scheduling, right? So, quote, it was on, but the operational piece had not evolved. And so, what we went from is doing around 14,000 online scheduling appointments per year. Now we're doing 14,000 per month, right? And that was within about 12-month change. Thousands of fewer phone calls, people making their own appointments, and so the downstream impact of that, both from a revenue and a cost perspective, has been enormous.
So online scheduling is a fantastic use case, right? This is really where you can make a difference with digital. You're empowering your consumers to, make their appointments. Maybe do a bunch of other things, do a little symptom triaging, maybe make their co-pays, everything online. So you're really effectively giving them the empowerment, also, lessening the burden on your own organization at the same time. And presumably there are very good trade-offs that you're measuring. Let's talk about the challenges. Let's just take that same example. And online scheduling, we've seen this. My firm works with health systems, as you know, Tarun, and we've seen every possible flavor that you can think of. I'd love to hear what you've obviously accomplished a significant amount, because you just gave us the numbers. 14,000 a year to 14,000 a month. That, by any definition, is great progress. What were the challenges you had to overcome?
Well, and so an analogy I like to use is the fear factor, right? Do people necessarily resist change because they don't see the promise? No, I think you can, most people can say, yeah, I can see the promise. But the question is, I can also tend to see, and specifically, I would say working with physicians, because again, it comes down to our training, right? We go through residency training, it's gladiatorial training. If you do X, Y, Z, Q, W5, patient survives. Now we're saying, hey, listen, skip a couple things. Don't go through this convoluted path. Just go from here to here. It'll be fine. And I'm like, but wait a minute. I know if I do this every single time, I get a good outcome. So the question comes down to is trust.
Right.
And for us, with our clinicians, we would say, okay, help us understand what makes you worried about putting your schedule online. Mm-hmm. And the biggest fear over and over was, I'm worried that the wrong appointment is going to get booked. And what that means, okay, well, what does that mean though? And that means is, well, if it's a brand new patient who booked into an established slot, new patients, I need half hour, 45 minutes longer. Established patient, maybe that's a 15, 20. I'm behind already. If that happens first in the morning, I'm catching up all day, right? So I said, okay, well, we can work towards that, right? So maybe we can, if you got, and listen, you always want to have your folks who are your early adopters.
Yeah.
You just let them go.
Yeah.
Your late adopters are going to be really hard, but in between, if you can get the momentum in between, then that's where it is. And that's just working. Let's do a couple. Turn it on for a day. Right? It's not a big bang approach. Just turn it on for a day. How did it go? Oh, it was okay. Let's turn it on for 2 days. Right? I know it sounds, that could be painful and it's iterative, but the reality is that's how change happens.
Yeah.
Yeah. So, you know, I was decided back to, it's like an Atul Gawande article, Slow Ideas. Everyone wants everything to go viral. And when they do, it's wonderful. But some things don't go viral, and you just have to work with people and meet them where they are.
What a fantastic story. Change Management 101. I think you just described the whole thing very eloquently. So I'd also like to touch upon the technology enablement aspects of this change. Now, you talked about the human element, you know, physicians and clinicians who are worried about exposing their schedule and that getting in the way of their work. Let's talk about the tech. What challenges did you have to deal with when you implemented the tech? Or the data or the infrastructure? Just talk to us about that whole ball of wax, if you will.
Yeah. So I had put this in my LinkedIn profile. I don't know if I did come up with this de novo or if subliminally I stole it from somebody else, but I have heard the statement, culture eats strategy for breakfast. Yeah. Well, if that's the case, then workflow eats technology for lunch, dinner, and dessert.
Right. Well said.
And we've all seen it, right? You ask someone to swivel between screens, I already know this is going to be, I mean, the impact of what I'm going to get if I swivel to another screen, to another login, even if it's single sign-on, it's got SAML tokens, blah, 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 I already know voltage drop is going to be enormous. So the other thing though is, I think one of the questions that we try to ask, and I heard it from somebody else, they always ask, so what? Maybe there's a nicer way to ask it. If I do this technology, what am I going to get for it, right? What is the proposed return? And so, one of the things our team uses, whether you use a balanced scorecard or SMART goals, I mean, we like to use OKRs, objectives and key results.
Yeah.
What are my leading key results? What are my lagging key results? Fine, if I put this in, one of these numbers has to move. And then one of the other things we do from a technology perspective, if it's not moving, are you prepared to rip it out? And another thing we also do is for every one thing we bring in, we need to rip out at least 1 to 2 others, right? Because it just cannot be this, I think about this poster from the 1980s, he who has the most toys wins. Mm-hmm. Not a viable solution for us in this space.
So you talked about the technology options, the technology solutions, talk about rip and replace and so on. So we are living through a moment, there's literally thousands of solutions for you to pick from once you've designed the experience. These solutions come from your native EHR system, they come from nimble young startups and enterprise class tech firms, everything in between. How do you go about making the choices? And talk to us specifically about what you see as the current moment for digital health startups in particular.
Yeah, and especially given the frothiness of the investment market has normalized for now. So I mean, I think I can certainly give you a framework we look at things. So one of the things, and this is important for us, not everything can be transformational. And incrementalism is not necessarily a bad thing, right? So some things, hey, listen, we just need to get a little bit better at this. We need to constantly iterate. I would think of something like order sets. I got to make my order sets better. I got to make my, some of my other functionality within my EMR better. That's incremental, and that is important. You can't stop that. That's not where our shop focus is in. We try to focus on like 5 or 6 major transformational things, and we have to stay focused. And I think one of the problems we had, and one of the mistakes I'll own early, is it didn't say no enough. Mm-hmm. I am trying to say no a lot. And if you really want to do this, operational owner, you have to prove to me what you're prepared to do this, right? Because it's not, I can't make the change for you. I will make the change with you, is how we think about it. But with regards to, when we look at technology, I think we look at it as, is this a problem that one of our existing solutions can either solve today or in the next 18 months, somewhere in that window, right? It's a little bit different depending on the problem. If it can be solved today with an existing solution, man, to go outside of that, you really need to have a really good explanation, right? Why someone wants to go with a tool outside of that. If it can be solved, it's not there today, but one of our existing tools has a good roadmap to get there in the next 18 months, then it's a decision on, severity of market need, demand on that one. And then if it say, no, we feel pretty confident it's not on the roadmap or it's 2 years out, then we're open to go looking with, working with a startup or a partner who's trying to answer this question. That stated, very transparently, we don't sign 10-year contracts, right? Constantly kind of have to keep proving yourself, because the reality is one of those native systems that we have on our native platforms eventually is going to catch up, right? And it's probably going to offer it for a fraction of the cost of what the startup is. And I'll give you an example with video visits, right? Video visits, we were paying hundreds of thousands of dollars for video visit solutions. Now we're paying 28 cents for one video visit, purely click as you go, right? So as the commoditization happens, the startups have to continue to say, what is the problem I am trying to solve? If you may have a good contract right now, you have to work off the assumption in 3 years, that problem someone else has solved for cheaper and it's been commoditized. But take the learnings you've had by partnering with the health system to say, okay, what are the problems am I seeing? I'm going to help you solve that. That's an approach that I think when we look for when we partner with folks.
You said something really profound there, Tarun, and I want to go back to and make sure I heard it right. You said that, firstly, you don't sign 10-year contracts. That is understandable. But you also said that you anticipate that some of your enterprise class systems of record, EHR, whatever you want to call it, you anticipate that they're going to eventually catch up to the digital health startups and the innovators. And so what I'm hearing between the lines here is that as and when that happens, you will rip and replace a standalone solution and move more towards a more consolidated applications infrastructure. And so essentially that stacks the deck for the longer term against startups. Am I hearing you right there? What's your advice to startups who are listening to this?
Well, it's simple. It's the reality of the world, right? I mean, and I don't think there's anything I'm saying on the healthcare space that's any different than any other space, right? I mean, everything in tech, healthcare side aligned. I mean, you got the big five in their respective areas.
Yeah.
Right. I mean, we know in talking to a bunch of startups, listen, I ask them all the time, what's your exit strategy? And like, be acquired by Optum. Right. I mean, that is literally like half of the startups we talk to is like, why? Yeah, that's our only choice. All right. But, I will tell you, though, some of the startups I've seen and worked with, and, once they get acquired by Optum, you have to understand something like that happens. When you get pulled into that space, it changes the dynamic of the original relationship. Because in some cases, we want to work with people who are independent outside of the ecosystem. Some places, it just makes sense for it to be part of the ecosystem. So, being mindful of, am I sitting in a space that benefits me being somewhat separate from the big ones, or complementary, or eventually tied in, right? Because I think there's this big misnomer in healthcare IT that the health systems are flush with cash. If you think that's the case, you can look up at our P&Ls, right? Because we're almost all not-for-profits.
Yeah.
We're talking low single-digit operating margins.
Right.
So I wouldn't say bloodbath would be a strong word, but I think it is very, very difficult and tight. And each day you have 10,000 people leaving the commercial insurance world where that pays better to the Medicare world.
Yeah.
Right. So, you just have to, it comes back to that value proposition. I think unfortunately, I don't know if I'm giving anything profound here,
Right.
but understanding that value proposition you're truly bringing.
So that obviously begs the ROI question. You're making a lot of digital health investments. Now, the example you gave of online scheduling, that one is pretty obvious. It's paying back for itself. But there may be others where they're either at the margin or potentially at risk of being discontinued. It sounds like you're making these evaluations on an ongoing basis. Is there a rubric that you use when it comes to building a case for a new solution where there isn't adequate data for you to say whether it's going to work or not, especially in a margin constrained landscape like healthcare providers?
Yeah, I wish I could say, we put into an Excel spreadsheet and a formula comes out, and if it scores 99, we go with it, and if it comes out with 60, we don't. Right? I would love to say that. I will tell you there are some gut calls sometimes. Again, we won't leverage the house on a gut call.
Yeah,
that's not something we're going to do. But I think one of the things we've stated though is our investment in digital. Our thesis is very clear. It has any incremental investment has to help us gain consumers who want to be part of our health system, retain consumers who, if we don't offer this, are going to find another solution that is, that meets their value proposition. And then it has to be real tangible savings. All right. It can't be this soft, sometimes I look at some of the valuations and the ROI calculations folks come up with. It's like, oh yeah, we'll save you half a day in the hospital, which will then lead to $10,000 of savings. So like, yeah, maybe you're off by like 2 decimals there, right? I mean, it has to be hard, tangible.
Yeah. Well, I'm sure the venture capitalists listening to this are also taking note. We are going through a moment, as you pointed out, the VC funding environment is pulling back just a little bit. We are in a very interesting time here, and so we are coming up to the end of our conversation for this podcast. I'd like to ask you one last question. You've been in this role now for 2 or 3 years. In fact, I would argue that you came into the role almost at a perfect time because you had the opportunity to really experiment with a lot of things because the market gave you that opportunity to do so. If there's one thing or 2 things that you would like to share with your peers who are listening to this conversation based on your experience as a Chief Digital Transformation Officer, what would those be?
I'll give 2. I think they're probably the same thing, but maybe slightly different ways of saying it. So when I was in a startup when I first came out of training. One of the guys who mentored me gave a statement that one of his mentors gave him, and that is, no one ever went out of business because they focused too much. All right. Now, you may not be the biggest business, you may not be getting, on the speaking stages, and you may not be on the cover of XYZ magazine, but you'll still be in business.
Yeah.
And I think corollary to that is, and a term we use inside of our organization and specifically my team, is cold-blooded execution. There's a lot of there's a lot of talk, but at the end, those who execute will win. And there will be winners and losers in this space. We've seen it over the last couple of years. That will only continue to accelerate. That is relatively new for integrated delivery networks, right? There are integrated delivery networks who are essentially either are going to have to get acquired or in some cases shut down because they did not thrive in this business. But cold, hard execution. Ideas are wonderful, but execution wins.
Fantastic. That was such a wonderful conversation. Well, Tarun, I'm afraid we're going to have to leave it there for today. It's been such a pleasure speaking with you, and thank you so much for sharing your insights from your work. And we'll be watching and cheering for you and your team from the sidelines. Thank you once again, and all the very best.
My pleasure. Thank you for your time, and really look forward to it.